Welcome to the Sensitivity is Your Superpower podcast, where we explore all the ways sensitive souls can thrive in today's world. I'm your host, Dr. Karen Kanji. Let's connect.
Hello, hello. I'm so excited today. Yes. Why am I excited? Well, we're going to be talking about facelifts, but not like the surgical stuff. Like, I'm a medical doctor. I've seen it. It's not pretty. And yet, it is still popular. And today I have with me Deanna Hansen, who's been, I would say a friend for a number of years. I got introduced to her amazing block therapy. Who knew that you could just lie on this block and have amazing bodily transformation, right? So we've had her on the podcast many, many times. And I recently bought her face paddle. It is not for hitting yourself. Okay, I swear it's not for that. So maybe we can do a little demo. So I'm like, I'm so busy. I'm like, I really gotta, actually do the class. So I bought the face paddle, and so here I am. I'm gonna sit by, watch the Discovery of Witches tonight, and kind of, press on my face while I'm sitting in the couch. And anyway. So let me tell you a little bit about Deanna. She's a fascia expert. She absolutely is. Pioneer, best-selling author, known for transforming how we understand and heal the body. With over 2 decades of clinical experience, she created fluid isometrics and block therapy, innovative fascial decompression methods that blend diaphragmatic breathing, I love that part, with deep tissue work to release adhesions, oxygenate cells, restore postural and emotional alignment. Her unique approach helps people relieve chronic pain, reverse patterns of aging and dis-ease, support detox, and reconnect with their innate healing intelligence. Through blocktherapy.com, Deanna has guided more than 12,000 students, from healthcare practitioners to everyday individuals, to healthier, stronger, and more vibrant bodies. She's a gifted...
Did it say 12,000? Did it say 12,000?
Yeah.
That should be like well over 100,000. That must be old.
Oh, 100,000. So, gifted teacher and speaker. She's also the best-selling author of Unblock Your Body, Groundbreaking Guide to Awakening Cellular Health Through Fascial Decompression. Deanna's mission is to help people melt tension, unlock emotional resilience, and experience a renewed sense of freedom from within. So, Deanna, welcome to the show.
Thank you, Dr. Ken. Sorry I interrupted. I was just like,
what? No, that's okay. That's a small number. I was thinking, oh no, is there an extra zero? And you're like, no, there's not enough zeros. Oh my gosh. So Deanna, when we're together, I start laughing like you because I love your laugh so much. And I'm just realizing James is going to be like, wow, you sound like her when you're laughing right now. But that's because we're together. Thank you so much I know you're super busy. You have this incredible, amazing teaching schedule. You've got these retreats now. One of these days I'm showing up to one of these. And yeah, thank you so much for being here today.
Oh, thank you so much. It's so great to see you again. And just if everybody didn't know, you are one of my leaders in my trauma program.
What do you mean?
Well, you were in my trauma program. I interviewed you years ago.
Oh,
yeah. So you're part of you're right inside my platform.
That's right. Oh, wow. Yeah, I totally forgot about that. Thank you. Yeah, that was fun. Yeah, I think
it was very valuable information. My community loved you. So
wow, that's great. I thought we could be a little too woo woo there with I don't know what we're talking about, ghosts or entities or aliens or something, but that's normal talk for our community.
100%.
Yeah. Okay, so maybe you can give us a little, for the folks that are brand new to your work, give us a little rundown of how you discovered this, like your personal journey, and then we can kind of segue into like, what's this got to do with facelifts or natural facelifts?
Yeah. So it was, I guess, about 26 years ago that this journey really began for me. I was 30 years old, and at the time I was struggling with my own personal body, my own mental health. I was already 5+ years in as being an athletic therapist by profession, always focusing on deep tissue work and working with elite athletes. And although I was working really hard to create a body that I wanted, the harder that I was working, the more compressed, the more ballooned, and the more toxic I was becoming. So this, added to what else was going on in my life. I was really spiraling down into a deep depression. And at the age of 30, I made some big changes in my life. The results of some of these changes, though, created severe anxiety attacks for me. And it was this one anxiety attack in particular that really was the foundation of everything that I've built from that time forward. Because in the moment, I actually thought I was going to die because I was so frozen in fear, I couldn't catch my breath. So for some reason, I intuitively dove my hand into my abdomen. And the first thing I encountered was pain, but that was good because it brought me back into my body. And then I started working intuitively in the tissue. And what I felt under my fingertips was what felt like scar tissue, even though I hadn't had any injury or surgery in that area. And suddenly I had these aha moments like, well, no wonder when I'm coming home from a 5 mile run and I'm dripping wet with sweat, my belly would still feel cold. So suddenly I'm recognizing that all of my efforts, and I mean, I'm extreme in what I do. So I was running Tai Bo, 400 sit-ups a day. That took me in the opposite direction. Weights, all the things that I was trying so hard to force my body were actually making my body worse in how it looked and how I felt, in how it functioned. I was constipated. I was in this horrible space. So now I have my hand inside my tissue and I start working. And the first thing that I felt was calm. So after that first evening, I felt really good. I woke up the next day a little tender, but the tenderness also kept me grounded. So I was really excited to go back home after working with my patients and continue with the work. And after the second night of just exploring in my tissue, when I stood up, I felt taller. And I went and I looked at myself in the mirror, and my belly was flatter than it had looked in years. So suddenly I was like elated, and this became my new daily practice. So I gave up all the other stuff that I was doing. This was what I was doing. And within 2 weeks, my chronic low back pain was going away. My neck pain was improving. Like everything was changing. And most importantly, my outlook on life had changed. I was actually hopeful for the first time, which was so not my nature. So after not very long of working in a very similar way on my patients and getting these crazy results with them as well, I started attracting other therapists to come and learn my work. And so that was 26 years ago. And that was the very beginning of me diving into first my own tissue and then applying it to others. And probably 2 years later, recognizing that I'm actually working in the fascia system.
Okay, so there was this 2 year time period where it really like you figured out like what exactly you were doing.
Well, and it started because one of my clients said, "You should be teaching this." And I thought, geez, like I'm just really going with the flow. Like
Yeah.
I'm just intuiting what to do. So then I started to really pay attention. And at the same time, I also started to read some books talking about the Fibonacci sequence. And I recognized that this is the pattern that my hands were intuitively taking in the tissue. So the Fibonacci sequence
Mm.
is the spiral pattern of everything in nature, including how our bodies form, including how we age. So when I started to really see what pattern my hands were taking and then recognize that, wow, this is what's actually happening, I started to put two and two together and recognize that I'm really drilling through the seams of time in the tissue as opposed to stroking the body like so many
Right.
techniques are, which keep you on the surface. So that was again like sort of a hit of inspiration 26 or 24 years ago at that point. And then I needed to create a language to really support what was happening in the body, which now I term fascia decompression.
Mm. Yes, and I think the languaging you're using is actually really, really clear. Especially, through the various many, many, many classes that I've taken, it's very consistent, it's very clear, and it's easy to follow. And who knew that breathing is a big part of this? And I remember one of the podcasts we did together, I think we were talking about weight loss or something for a moment,
Yeah.
and you were telling the story about how you used to do 400 sit-ups, right? All this ab work, which, my husband likes to tell me I should be doing. And oh, he's not going to get in trouble later. And you're like, it's so important to breathe and breathe out fully. Like there's a lot in your class where you talk about that. And you were talking about the study. It talked, that tagged the fat molecules, for lack of the carbon, with radioisotopes, and they found it came out of the breath. And you're like, yeah, if you want to lose weight, you got to breathe properly. I'm like, what?
I know. And that was such a beautiful moment for me to recognize that because again, all of the work, I mean, the sweat, the time, the breathing so heavy and hard with the workouts and getting bigger. It's like, Why are the rules of weight loss not applying to me? What am I doing wrong? And it was so frustrating because I'd be working with these athletes. I'm in the gym doing the same thing, and yet I'm going in the direction that's different. And it was actually because I had also started the practice of yoga at that time, and I had a fantastic teacher that every 30, 45 seconds in position, she'd be reminding us to breathe. And every time she reminded us, I'm like, wow, I'm holding my breath. So that in that same moment, that became a very foundational understanding that basically I've put myself in freeze mode. So, anything frozen, it doesn't matter what you're doing. You got to melt it. You got to get it moving and get the energy flowing through it. So, yeah, that was just I remember it like it was yesterday, that moment in time when that hit happened for me.
Wow. Wow, that's amazing. Now, let's talk a little bit about, a lot of us as we get into our 60s, like 50s, 60s, we were like, oh, we would like to, keep our youthful face. And what I've noticed, and I see my aunt, I have a lot of kind of like genetics, if you will, of that side of the family, my dad's side of the family, is unless I'm smiling, I noticed this droopy thing happening. The eye droopy thing, the jaw droopy thing. And I remember one time you said the importance of the tongue, that the tongue is connected to everything. And I, saw this picture of the tongue and the fascia and it's connected all the way down to my big toe. I'm like,
Yeah.
seriously, this is crazy stuff. And so I started, doing kind of a form of mewing with the tongue at the roof of my mouth. But I got to tell you, when I'm sitting around my desk, don't necessarily remember all that. And then you came out with a facelift program and then the paddle. So maybe we can talk a bit about everything. That why are we drooping? How's the tongue helpful or not? And what do we do about it?
Yeah. So whenever I'm looking at a body, I actually look starting from the feet up. So the head is
Mhm.
the apex of this entire system. So I'm just going to talk quickly about fascia and what really it's made up of and what happens to it over time if we're not conscious of posture and alignment. So there's a lot of things that make up fascia, but there's two main proteins, collagen and elastin. And so the collagen, of course, gives us this structure so we don't turn into a puddle. The elastin allows us to have movement. When they're properly balanced, then what's happening is we have our cells in correct alignment. And the reason that's important is when cells are where they're supposed to be, there's optimal space in and around the cell, space for ease of absorption of nutrients in, as well as the removal of toxins and debris away from the cell. So if that's the case, there's ease of flow. With ease of flow, there's really us going through time without the accumulation of what gravity will do to us. So the reality
Mhm.
is, though, we are constantly getting pulled down toward the earth. We essentially get shorter and wider as we age. So what's happening to this balance of collagen and elastin? It's the collagen component that will end up migrating to areas of need. So let's say I'm sitting in front of a computer for decades and I'm slouched. So as I'm slouching over, I'm going to continue to fall over and land on my face unless there's some structural scaffolding in the body to stop me from tipping. And that's the collagen that migrates to areas of need. So it will migrate and accumulate, and then it becomes dense. And it will grip to anything in its path, including bone, with a force of up to 2,000 pounds per square inch. So we literally get magnetically sealed out of alignment. Now imagine this face for 20 years, what gravity will do to that face compared to this face. When we have balance and we have structural support in correct alignment, then gravity doesn't have that same impact compared to when I'm hanging like this. So if I'm always aligned this way, this side of my face, where now everything is going to start to hang, those collagen proteins grip to bone. But that gripping causes a jowl because now we have the elastin without the balance of the collagen and it starts to hang and sag. So that's just an example of why things age over time. We are literally tipping off balance and we don't have that wonderful balance of both proteins inside our body to create the support. So that's basically a result of fascia compression. We become shorter and wider over time. So the process that I teach goes in the opposite direction, fascia decompression. So there's a space-time continuum. As we go through time, we decrease internal space. What this work does is it puts the space back into the body that time has taken away. So what we do, as an example with the tool, let's say this is the area where we've got like all this stuff. We get into the area and we'll sit and we don't rub on the skin. We want to create pressure over time. Pressure creates heat. When you combine that with turning on proper diaphragmatic breathing, which is always part of what we're teaching, then we're starting to heat the area combined from the turning on the furnace from the inside as well as the outside with pressure over time. And then we start melting or releasing those collagen proteins from where they're stuck as we focus on teaching people how to inhale into that space or move directed blood flow into that space. Then those cells that are now hungry and awakened, they absorb the oxygen and they plump up. Think of blowing up a balloon. You know, a nice filled balloon is round, it glows, it almost defies gravity. That's what we want our cells to be like. We don't want them to be heavy and sluggish and dirty. But when we don't have optimal oxygen in the body, which none of us do because we're not breathing properly, we have cells that look like a balloon that's deflated. And that deflated balloon has wrinkles, it attracts dirt and debris in the creases, it becomes heavy, and it starts sinking toward the earth. So that's what is essentially happening to every cell as we go through time. We have this collapsing of the cell structure inside the body, and we don't have proper flow. So cells become hungry and dirty. And think of how you feel when you're hungry and dirty. Not real good. So the goal is, again, we want to move in the opposite direction to make sure that we can pump that oxygen into these newly created spaces to plump up the life, to help the lymphatics move the toxins away so we can clean the skin, we can clean the cells, we can support feeding them with the proper nutrients. And part of our work is also teaching people about the proper postural foundations, the tongue being one of them. But it's so much easier once you've created some release, though, to be able to work the tongue, because even the feet are really the key here. Again, when I'm looking at the body, the feet are the furthest from the engine. So that 2,000 pound per square inch force, it holds us most strongly at the foundation because they're, again, the furthest from the diaphragm, our furnace. So whenever I'm looking at a body, there's always one foot that pulls away, like a flat tire. And then the other side of the body anchors to stop you from tipping. But this creates twisting up the chain. So that twisting is going to be pulling us down into these patterns. And then that's how we start aging, and our body's constantly compensating for this negative alignment. And we keep shifting those collagen fibers to areas of need as opposed to creating that balance. So as that happens, again, the cells aren't getting properly fed and clean, and they go through that aging process. And whether it's a skin cell, an organ cell, a muscle cell, a whatever cell, you're going to have some kind of a symptom if that cell isn't getting what it requires to thrive. And, you know, that's where pain comes in. And pain is just a language. It's not something to fear, but we get caught in a pain-fear cycle because if we don't understand pain, it's scary. And then we hold our breath even further because that's what we do when we have pain, stress, and fear. We reactively hold the breath, and then we send the body into a worse scenario because now we're starving it of its most vital nutrient, which is oxygen.
Yes, yes. Well, you know, just when we just did this tiny little thing right here, I wasn't pressing very hard, but this muscle, it felt like muscle pain. I know, well, that it doesn't, I could tell the difference in fascia. Well, fascia's around the muscle as well, so who knows who are the pains coming from. That's so interesting that this tiny little thing right here, I was like, ah.
Truly, if you go deep enough anywhere, you're going to feel pain. And here's probably one of the worst ones, right here.
Oh, yes.
Give that one a try.
Oh,
Yeah.
yeah.
We should be able to put our fingers underneath
Yes.
the
I was
jaw.
actually working on it with my fingers.
Yeah, and
Yeah,
so like
that's
what we'll do
intense.
with the paddle is it's nice if you can put like a yoga mat on the table, and then you can just lean in, and then you don't have to
Mm,
work so hard. And then the
right.
leaning in itself really gives you that
Oh,
pressure.
yeah.
And then what you do is when you start feeling the softening, you can just very slowly start to manipulate the paddle so that you're moving more deeply. So with the
Mm,
program, we actually have 9 classes that make up this paddle series. We start right through here, so we make sure first we open up the
yes.
lymphatics before we start creating all this disruption up through here. Then we go through here, then we get into here, then through here. So we've got 9 classes that kind of cover the whole area. But what's really
Nice.
exciting, and I just want to share with you, in January, for anybody that has the paddle program, I'm putting together a 21-day facelift challenge. And I'm going to come out
Ooh.
and do 6 live calls and teach people more cool stuff to do with their hands on their face. That's going to make tremendous change. But I would love to share one with you when you're ready to hear, because this is one that I've been doing now for 6 months. I have everybody in my community doing it. I have it on YouTube all over the place. And the changes it's created in my face are truly mind blowing. It's the first thing I do every morning in the bath for 3 minutes. My lips, after 3 months of doing it, started to literally crack open and fill and fill and fill. And now I have
What?
lips, which I've never really had, like full lips before, and they've filled in. And also my jaw, when I used to talk, it would always kind of move to one side, and it's created symmetry with my jaw now. So if you want to do that now or later, let me know.
Oh,
But I'll show
yes.
everybody.
Yes, let's do that now.
Okay, so you got to have your fingers in your mouth though.
That's
Just
okay.
saying. Okay, so what you want to do, I call it the tongue decompression technique.
Ooh.
And the reason I started doing this, I have all four wisdom teeth, but I have two molars that I've had removed. And of course, if we don't have something in the space, things start to collapse in. So knowing this, I wanted to keep the breadth and I wanted to keep that space between the teeth. So you take your third and fourth finger and you're going to put both of them in at the same time, but I'll show you first here. So below the teeth at the gum, you
Mhm.
want both hands in, and then we're going to draw the fingers down into the tongue area and we're going to draw away. So we're going to create pressure down and away. If you want to do it for 3 minutes, and if everyone wants to do this for 3 minutes, you're going to be blown away how it's going to feel. You want to give it a try? I'll count. I'll time.
Okay.
Okay, do it. All right. Okay, so fingers in. So you keep them in, and I'll just kind of talk as we're doing this.
Mhm.
So what you'll probably notice on one side, you'll probably feel it's denser and you might have more pain. That's pretty typical because A, we're not symmetrical. So our goal is that we open up this space under here so that we open up the lymphatics as well as we open up the blood and oxygen into the head. So now you're pulling down and you're pulling away. And as you maintain that pressure, see if you can take your tongue up to the roof of the mouth like that mewing alignment. And so you can
Mhm.
even kind of like pulse it just to get that little bit extra energy in through there. So again, we're going to be here 3 minutes, so you still got a little bit more time. You might be salivating a ton. That's normal. That's actually a good thing if you are. So we want to keep pulling away. You want to think as broad as possible because as we age, what happens is the head becomes more narrow and drawn down. We want to bring that breadth back. We want to have the space for the brain, for the eyes. We want the symmetry in the jaw. We want all the room that we can have for the teeth because that's why teeth get crooked over time is everything's getting twisted and pulled out of alignment. So another minute and a half or so. See if you can even sink your fingers in a little bit deeper now. And again, like with block, your breath is your guide. So you only go as hard as you can with a relaxed breath. If anything hurts too much, it's taking that relaxed breath away, then that's too intense for you. But it's quite amazing because as we start to open up this area and bring symmetry and balance back into the jaw, I've had people say just from doing this once, their pelvis shifted. They suddenly feel like their feet are warmer. I'm getting the weirdest things people are sharing. It's quite fascinating just from doing this. So again, this is a daily practice for me. I'm 6 months in. I can't even tell you how grateful I am that I've been doing this. Let's do about 30 more seconds.
Mhm.
And when you're ready to take your fingers out, we don't want to just rip them out because if we have a lot of dehydration in here, sometimes the fingers get sticky onto the tissue.
Mhm.
And if you rip them out, it feels painful. So you just want to be thoughtful and you want to take them out nice and slow. But let's take 3 more slow, full exhales here. And when you're ready, slowly remove them.
Wow, that was tender.
Yeah. How do you feel?
Mm, I'm sore here. That's
We awakened
interesting.
something.
Yeah, because I know like I'm sometimes I'll be like doing like a version of face yoga on the power plate and I'd be like putting the tongue over my mouth and I'll be doing the stretch like I'm pulling down here.
Yeah.
And it's like super tight here and not so tight here. So I know I'm uneven.
Yeah.
So that this does not surprise me.
Yeah.
Like I
Yeah.
didn't feel like I was even getting that deep, right? But I'm like, oh, that's a little bit sore.
And this handle is so nice
Ooh.
to get into that underside because yeah,
Okay.
like if you think about it, how everything gets
Yes.
pulled down and twisted on the underside of the jaw is where
Yeah.
so many adhesions
And that's
form.
why we have the,
Yeah,
right?
yeah.
The double
And the
chin.
thing is, too, the double chin is actually a displaced weak tongue. It's
Mm-hmm.
because the tongue has sunk, and it really should be supporting the roof of the mouth in order to support even the brain alignment. So when that tongue is off,
Mm.
then everything is off. And you can see that with a lot of mentally challenged people. You can see a very, very low hanging tongue because they simply don't have that support inside their head to support the brain. So it's neat when you really kind of tie the posture with certain conditions and issues together, and you can see why things are happening in people. So yeah, this was. Did you like it?
Okay.
I do it in the
I
back, so
like
I'll do it lying on my back.
it's great. I mean, we can do it sitting up, we can do it lying, right?
Yeah,
And I'm thinking in the morning when I'm like, I have this book stand and talk about posture. I was very uncomfortable looking down like this because I love reading.
yeah.
So James and I have this book stand, so we're looking straight on. And sometimes I'm doing little lymphatic sweeping, but this would be another thing I can be doing when I'm reading my book.
Well, and I mean, there's nothing that is going to give you that same benefit of lymphatic drainage than creating the space and getting in
Space.
there. And what's wild, again, like I'm 6 months in. So this morning, even when I was doing it, you feel these folds of adhesions coming up and coming up. And when I started, when I put my tongue right right there, I had a very narrow space. Now I have a really wide space. Like I can move my tongue quite far left to right, where in the beginning I didn't have that much room. So I also had, because of those molars removed, I had this side of my mouth, those teeth were starting to really come this way, and now they've come back up and out. So that's changed my bite entirely and changed how I chew. It's changed the whole dynamic of my face, really.
Oh, that is really cool. Okay. Yes, I will begin doing that. That's good. And um, I said to James the other day, he's like, I don't think that mouth tape is really working for you because you're still snoring. And I'm like, I think I'm doing it more for beauty than for snoring. Because I see a lot of older folks, like when my dad was, like very, very sick, and he's passed away since, but he would do that old person's like, that thing,
Yeah, yeah.
right? And I'm like, oh, we don't want to sleep like that. But that's what I see like now, my mom does it. Like, it just seems so common. So is it complementary at all to, I mean, it's not what you're doing, but is it complementary to mouth tape at night so your mouth isn't hanging, so it doesn't oppose what you're already trying to do?
Yeah, absolutely. And the thing is, it again, if we think of the limbs, I'll talk quickly about the diaphragm because this is such a key piece.
Mm.
So the diaphragm lives, of course, the foundation of the rib cage. When we inhale, this plate of muscle moves down. When we exhale, it lifts. When it's working properly, it's giving all of the organs a continual massage. It's also strong as a foundation for everything up the chain. Now, the issue is pain, fear, and stress cause you to reactively hold the breath. So, who's not in 24/7 stress mode these days, right? So, everybody's stressed. Everybody's had trauma, injury, all of the stuff. So, the majority of people in the world are breathing through the muscles of the upper chest. And then there's people like me as a dancer when I was a kid, hold your belly in. Well, now
Yeah,
I'm
me too.
forced to breathe through the muscles of my upper chest. So then this foundation becomes really weak. And then what happens is the weight of everything above starts coming crashing down into that core space. And here's the reason why we get the spare tire as we get older, not because we accumulate fat, because we compress and balloon. And when we compress, now we don't have this muscle working on our behalf. Now we have lack of absorption of nutrients, as well as the lack of the removal of waste from the body. So we get a backup of waste, that adds size. We attract parasites, they create waste, that adds more size. So we become compressed, ballooned, and toxic. And so that's what happens to the abdomen if we don't have proper breathing, but we also become twisted. And then that
Mm.
twisting gets patterned into the limbs. And the limbs, again, being the furthest from this furnace, this engine in the body, they are really what's locking our core out of alignment. Even if somebody has scoliosis, it's a function of the limbs. The core is simply the puppet master of what's going on with the limbs in the body as we're getting pulled and twisted. And then, of course, here's the head at the apex of it all. So if we don't really understand how to bring balance and symmetry back into the hands and the feet and then the head, all of the stuff in the core is getting manipulated by these anchor points away from our diaphragm. So that's why this is really a full body process. We do have in our program, we have added 3 classes that teach you how to do block therapy through the whole body, because it's just such a key piece. We can't just work on the head and expect the changes to stay because we're manipulated by what's going on with the rest of the body.
Ah, right, right. Well, I remember the first time you said about the importance of the feet and the calves and the forearms and that kind of thing. And you weren't the only one who, saw, my pictures and you were like, ooh, calves. And I was like, my calves are fine. They don't hurt. Right.
Yeah.
But I was figure skater, right? And that
Yeah.
skating boot, clamps on there. And, and then same thing with the arms is very interesting because I'm a keyboard junkie, right? So I'm like doing this thing in the dominant hand. I can tell when I'm doing lifting. We were talking about weightlifting, guys, before we turn the recording on, and I could feel on the right side there's a little bit of a catch, that I'm not in alignment, and I could feel a twist right in the forearm, like it's stressing it, like it's not too happy. So I realized I need to, work on that to undo it. So people thinking, okay, whole body, Deanna, how long is this gonna take?
So I'm going to give you a couple of more things that you can do that are really efficient that you can do when you're watching TV. You can do it while you're sitting on your podcast. So the thing about the hands is anatomical position, palms are facing forward. You look at a skeleton, that's how we're properly aligned. You look at anybody walking around, and for the most part, their palms are facing behind them. So when that happens, I mean, even sit here and just allow your arms to internally rotate and then bring them back into alignment along with the shoulders and feel how that helps to lift up the rib cage. So just the action of walking with your palms forward is going to help to lift the rib cage, giving you a deeper breath. But we get locked into the hands and the feet. So a really simple exercise to change this is, and I'm showing it up here, but I would do it more belly button height so you don't have to stress your arms. We want to push between the thumb and the index finger, and we want to hold for 3 minutes because we want to start to melt through the adhesions in the hands here, in the webbing. So we hold for 3 minutes, focusing on that exhale, breathing in and out through the nose. Then after 3 minutes, we do between the second and third finger. Then after that, we do between the third and the fourth finger. This one hurts me the most. And then after that, we do between the fourth and the fifth. And when you do that, now you've created a very strong repatterning of the hands because the hands are locking everything up the chain. So if we want to change what's happening here, we have to look at what's going on in the hands. And this is a really simple way to do it. And yes, everything takes time, but you can do this while you're doing other things. I mean, and you don't have to do everything all at once either. You can do one and then later you can get to the other. Now with the toes, same thing. Now it's a little different because you can't do it with your toes. Take a finger or a pencil or even a string and put it through. And we want to change the patterning between the toes. And this is really, of anything, I would say the tongue and your toes are the most important because every step you take will pattern you into the old pattern. So even if you have a frozen shoulder on this side and I'm getting locked over here, I can't lift my shoulder if my rib cage is twisted. I need to align my rib cage in order to bring that opportunity back. But that's happening from the feet. So to
Whoa.
change what's going on in the toes, creating that 3-minute release between each toe. And we want to feel it. Like you want to get into that pain area, right? Because that's where those adhesions are. And we want to melt through them. It's just those collagen proteins that have migrated. And when we do that, we release them. And then after I do the 10 toes, you just stand up and grip the floor with your toes for 10 breaths. And it's like you're pumping up the tires. So this is
Mm.
important because if we don't have our toes activated, and they now have actually connected longevity and toe strength,
Hmm.
huge. If we don't have our toes active, then we have a club and then we fall in and we twist. But if our toes are active and supporting our alignment, that shifts our center of gravity back onto our heels. So we stay upright. And when we're upright, gravity's not pulling us forward and twisting everything to such a degree. So the feet are so important. I did a video 2 years ago, Death Starts in the Feet, and it went viral. And it was amazing because it's really what's going on. And people aren't connecting like how significant the foot is to everything else. You could spend years working on an area, but as soon as you start walking, you get pulled into the alignment that creates the issue in the
Uh,
first place.
yes, and I think the first couple years in block therapy, I was working on the parts that I thought I needed to work on because my belly's sticking out. So I'm gonna just lay on the block in every way, shape, or form, like around the belly, around the belly, around the belly. And what used to hurt me a lot, now it's like not a problem. I can put an end on and stick it in there and breathe and the whole bit. And that's when I sent my pictures to you, and you're like, oh, you really need to work on your feet and calves, right? And then being a figure skater, it kind of undoes the good stuff, and then I have to rehab it afterwards. And so I have started doing some things, like if I'm watching a movie or a TV show, that kind of thing, I'll go and start doing I'll work on my feet, like with my hands. I know some other techniques as well, but and then I think this is great, like these little suggestions. And then the toe activation, I didn't really realize I need to do that afterwards. That makes a lot of sense.
Yeah, yeah. We want to spring in our step, really. And again,
Mm,
it's just like pumping up a tire. We want to pump up our feet so that we've got that spring because over time, they kind of pancake out and then they get patterned into, are we
yeah.
tipping more to the right or to the left? Like what activity are we doing? Are we playing a sport? Are we sitting all day? Are we manual laborers? I mean, like all these things add up to create the alignment that we have, but those patterns are really what creates aging. And what's really exciting, actually, is we don't have to age. We can go through time and we can stay aligned and spacious and allow for flow if we understand how to support the fascia by
Mm,
using the breath appropriately and by understanding the anchor points that we really need to undo. And the hand, as an example, it would be like walking around with, a 10-pound weight pulling you down. That's what this magnetic seal of the fascia to the bone does, is it creates anchors in our body that get manipulated by gravity. And then we constantly get tugged on by gravity wherever we're dense. And so it's those collagen fibers that create that density similar to scar tissue, or the same as scar tissue, really just formed in a different way.
hmm Well, I remember the different things I was doing in bed, because I know you like to block in bed. I like to block in bed as well. And one of the things I just saw on your Instagram was you had the block under your sacrum and then your wrist in
Yeah.
there. And I've done my hand. I know there's, I've done the programs with the hand. I got to tell you, afterwards, I mean, logically, we think, oh, that's dangerous. You shouldn't cut off circulation, to your hand or arm or something like that. But I got to tell you, with the breathing, it feels really good. Like afterwards, like it just feels like I have brand new hands and arms. It's really, really neat how that happens.
It's really like you're giving the cells deeper than what you're consciously aware of a hug. Hugs,
Um,
pressure feels good. Like when we're sad or we need some love, like we want a hug. So we're only aware of the cells that are getting properly fed and clean. And if we're breathing through the muscles of the upper chest, which most people are, we're feeding like maybe 10, 20, 30% of our cells only. And we're going
mm,
to feed the areas that are required for survival. But we want to thrive. And to thrive, we need to get every cell supported with blood and oxygen and cleaning in order to thrive in our body. So that's the beautiful part with doing this process. And the key is your breath is your guide and you're the one doing the work, right? So it's not somebody else doing something to you. You're being very intentional with moving into your own body with pressure with your breath. And again, if something hurts to the point where your nervous system is saying, I don't like this, your breath will show that through a stressed breath. And then we always say, if it's causing that, then we need to back off or do it a different way because that's your body letting you know
mhm.
it's not appropriate for you.
Yes, and in the starter program, or well, you have some things that on Instagram and showing, you or Quinn, your nephew, having a rolled towel.
Yeah.
to start off. And I remember one, and you helped me with this case. I had somebody in the office who was just super, super sensitive in the belly. And so you instructed, well, maybe we could just try something on the bed, right? And like I was thinking a yoga block, and you're like, no, no, that's too much. And so we went to super, just even having her face down on the bed with a pillow. Like that was loads, like it was
Yeah.
just
Yeah.
so tender in there. I was like, really? Yeah, it was amazing. And she's not normally tender, but just that it put her into stress just to think about, lying on a block or something like that. It
Well,
was
it depends on how much compression, how much of that rib cage has fallen into that space,
mm,
creating that ballooning. Think of a pimple, right? Like when it's about to pop and how it can be so red and inflamed and sore to the touch. Once it pops, though, then it's like, oh, thank God, it's gone, right? So when
yeah,
we have that amount of pressure
pressure.
inside this area and then we're adding more pressure, I mean, that's really just an indication of how weak the diaphragm is and how
Ah,
twisted the feet will be, because that's going to create twisting within the pelvis, creating likely an anterior pelvic tilt, which is
yep.
then going to pull the rib cage forward and down, adding insult to injury, and you're getting like pressure from above and below in that core space.
Exactly. And then I'm seeing this patient's gait in my mind, and I was like, yep, 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 that's how she walks. Yep. Yeah, so you just described her whole gait without even seeing her. So
Mm.
we're gonna have our VIPs here. If you want to put a question for Deanna in the chat or raise your hand so we can unmute you, just know you are being recorded. If you unmute, we'll anything that you want to ask Deanna. Deanna, as they're doing that, I would love to just clarify one thing. Sometimes people go, well, if I'm compressing myself with this block or the block buddy or the baby block, how is that getting more oxygen in? Aren't I compressing the blood vessels and preventing oxygen from going in?
No, not at all. And that's the thing. So the fascia loves pressure. Now, there's good pressure and bad pressure though, right? So pressure from unconscious collapsing is going to create the density that we don't want. When we move into that density on purpose with breath and intention, we create the heat to melt that holding pattern, to release those adhesions, and then to go deeper. But it's with the breath that we're directing the area to wake up, because we're moving blood and oxygen into that space that we're putting attention into. So, and we're doing it to ourselves, right? So again, if it's too much for us, our body knows, and the body's not going to intentionally hurt itself unless you are, because some people do, but you know what I mean, right? But we're designed to support like survival. So if something doesn't feel right for the body, again, your breath will let you know. So it's the pressure though from the outside combined that creates heat, combined with that breath on the inside. So think of your upper chest breath like a space heater and your
Hmm.
diaphragm like a furnace. So I'm in a building here. If I have only a space heater, I can only heat one room in my space. Turn on the
Right.
building's furnace, you heat the entire building. So
Wow.
when we turn on the diaphragm, then we're actually sending that life into the area that we're connecting to with the pressure. So that's what the difference is.
Oh, okay. Yeah, that's great. Thank you for that. The second question, by the way, I think there is a link in the chat for those that are here with us live for the recording, link for the paddle and a link for the starter kit and links to just all of block therapy. So we can go there in a moment in case you're having trouble finding it. The other question, Deanna, had to do with the belly sticking out. Now, you have some really great before and after pictures of you kind of in a bad posture, which is like I never see you in a bad posture, but you're kind of demonstrating it and your belly's sticking out. I'm like, she doesn't have a belly. Oh my
I
gosh,
can
look at
do
that.
it. I can stand up and show you right now.
Sure, let's do it. Let's do it.
All right.
And yeah, and then I have a question about breathing in that place. So
Okay, so
okay.
when we're properly aligned, again, we have cells and foundations stacked.
Right.
So, not that I have a perfectly flat belly, but I mean, this is how I typically stand, but most people typically do this. So, again, here's all of this content
Yeah.
falling into this space. So now, boom,
Wow.
it goes out. But when I
Wow.
lift it up and out, then you align yourself properly. So that's where just understanding posture in and of itself. Actually, I'm going to show you my back. I think this is probably one of the most profound befores and afters. I
Okay,
do have
okay.
a mic on, obviously, but again, this is how I'm standing for me as normal. This is most people. And I swear to God, I look 20 pounds more like this
Oh, wow.
compared to this.
Wow.
And that's just because we're putting things where they're supposed to be. So if we're falling out of alignment, we're going to have compression in an area, and then another area is going to balloon. And that happens everywhere throughout the body. We were talking about, what did you call them? Helens? High Helens?
Oh, so the little underarm dangle dangles, my skating coach calls them high Helens because you're like this and it's like shaking. High Helens. That's what she calls it. Oh my
Yeah, and
gosh.
that occurs because of that internal rotation. Because if I'm walking around with my palms facing behind me, then I'm
Yes.
lifting this way and I'm actually not integrating my traps into work. So when we're
Oh,
working from proper alignment, then we're supporting that correct alignment so that we don't have, I can make it flop too, but like it's all about alignment. And then if things aren't getting used properly and they're getting blocked from flow, they're also accumulating waste, which is going to make the area expand
oh.
as well.
Okay, yes, the waist will make the area expand. So in skating, there was a lesson that we had with one of the PTs, and she talked about because she said a lot of people do this excess. I can't do it on this, excess lumbar lordosis. So their
Yeah.
belly's sticking out, but their hips are back, and it's kind of a overly feminine way of standing sometimes.
Yeah.
And I can even see myself on some of the as I'm really focused on a skating move, I could see I have excessive lumbar lordosis. So then my belly's sticking out. And so she said, like, kind of imagine that I had a zipper and I'm zipping this together. But she said, but breathe down into the diaphragm, into your pelvis, into your like vagina, if you will. So I started doing that. I was like, oh, that's different. So it's like I feel like my diaphragm's working, but I thought, misunderstood possibly, the whole yogic belly breath was pushing your belly out. And
So when I teach, so it's we want the movement to come from there because that's how we get the diaphragm to work properly. Again, if I'm breathing through my chest and I haven't brought and we can breathe through the chest, but it has to come first through the belly and then we want to go through the right structure. So the relaxed breath should be the belly breath. And then if we're working out and we're having to breathe a little more deeply, it's through the belly, then the side ribs, and then all the way up to the upper ribs if we're taking that full breath. And we want to breathe into the back ribs. We want the whole rib cage to be part of the equation, but it needs to start low. So even in my lower belly position, when we're lying on the block, I'm teaching people like you want to move that lower belly into the block, which can be a harder action. It's easier to
it is,
access that
yeah.
up through here. So that's where we combine that rooting action, the squeezing of the anus with the exhale, because that aligns the pelvis so that
Ah,
we then have, for the important reason, we then have the space for here. So as I'm sitting here in this chair as an example, I always teach people to sit. You want to sit properly. You want to have your knees at 90 degrees and you want to have your feet firmly planted on the ground. When we do that, this is creating, and then you want to do my sit bones have equal pressure on both sides, or am I leaning over to one side or the other side? And then another great thing you can do is squeeze a book, squeeze a block, squeeze a rolled up towel. That's going to bring your hip joints into balance. That squeezing
mm,
action supports that alignment of the pelvis, which then gives us the best alignment for the breath. So sitting here, so many people sit with their feet hooked under. So as soon as you
yeah.
hook your feet under, now it's like standing out of alignment. And now we're manipulating the pelvis. So as I'm sitting, now I'm going to pull my pelvis out of alignment, which is going to create less room for my diaphragm to function optimally.
Okay. Well, I was sitting at that whole 90 degrees, and then another PT talked about how it should be 135 because that 90 degrees is like the chi does not flow there. So I started experimenting. I have a Sally chair. I have many chairs, many chairs. And I started sitting a bit higher, and so my feet are flat on something, but the hips are more open and the knees more open, and I actually found that more comfortable because I did find that at the groin area that I felt like there was like chi that was stuck
Okay.
in there. So I know there's different philosophies, and just curious if you had heard of that.
I hadn't, but I mean, that makes total sense. But again, like that's opening, right? It's opening and it's
That's right.
creating that opportunity for you not to get pulled and twisted. So that's the thing. And also, that's why I like sitting on wood because then you have this
Mm,
feedback. So I can feel where my sit bones are. You know, sitting on a soft chair or couch, you kind of
right.
fall in and there's all this collapsing that you don't even recognize is happening.
Yes, that conscious sitting. Conscious sitting.
Well, and
Okay,
that's the
so
funny thing. They say sitting is the new smoking, but I mean, standing poorly, sitting poorly, it's all the same thing. I mean, we're
mm,
blocking some kind of flow
yes.
somewhere if we're not standing properly either.
Yes, that is true. Okay, let's go to our questions here. So if you have a question, you're live on the podcast recording, go ahead and put that in the chat or raise your hand. Katie says, my traps are extremely tight, and I'm also noticing some ropiness right under my chin. What should I focus my attention to release this tension?
Well, starting again with that tongue decompression is great. I would start with the fingers and the toes. Um, are we gifting people our sampler program? Because we can certainly do that here if you'd like, so people can even give it a try. Um,
Yes, I don't know what that link is though.
We can get you that link. It's 9 classes using the rolled up towel. And it gives
Ah,
you that, and then you're connected and all that good stuff, but it gives you that really good sense and feeling for what this work does. And then from there, if you like the sampler program, you're going to love the rest of everything because the
yes,
tools go on a whole different level of depth, which is so beautiful.
that's
But I
great.
mean, I would basically start there because it's going to take you first and foremost through learning the breath, and that's the key piece. And it's not just about learning how to breathe, it's working through the rib cage so that we can release the holding pattern of adhesions in the rib cage. Because if I've been like this again for my whole life, I will only have accessible part of my diaphragm. So if I'm strengthening my diaphragm, I might have 25% working on my behalf. We want to open the whole thing up so we have this full plate of muscle moving up and down properly. And it's a journey because it's all patterned into your entire body. But most people, after trying the very first class, are like, wow, I feel lighter. I feel taller. Like there's that immediate sense that something's happened and it turns on the parasympathetic nervous system. So it also brings that sense of calm into your body almost immediately.
Yes, the calming effect is fascinating.
Mm,
Fascinating, especially your story about how you're really feeling down and out and then you dove your hands into your belly and you just felt so much better, like emotionally.
yeah.
So that's fascinating. I'll never forget that part. That was very, very, very interesting to me. Um, Lily said she signed up. Yay, Lily. Way to go. You're gonna love it. You're gonna love it. Now you mentioned earlier that to obviously breathe and then 3 minutes. Tell us about the 3 minutes part.
So our goal here is that we are taking an area that's frozen. So when an area has no flow, it's colder than if it has flow. I live in Winnipeg. You might be able to see the snow outside my
I got more
windows
snow
here.
than you.
So if my car is sitting outside overnight and it's minus 30, I probably won't even be able to start it. But if it's cold, you can't just start it and go. You got to let it warm up because it's cold. So when we're working with the body and the breath and we're starting with a cold frozen system, if we're not breathing properly, we're colder than we should be. We need time to create heat. We can't
Mm,
rush the heating. So 3 minutes, and this really started with me working with my fluid isometrics work before I created block therapy. That was what I would feel on my clients when I'm working with them with my hands that, oh, okay, now I'm starting to feel that deeper release happening. And so that became a very foundational piece that you can't rush melting. You have to allow the body the time to heat up with the breath and the pressure to kick in and it to all culminate together to create that proper release in the fascia. And we
okay,
can
so
also block
even
longer,
even
but
the little guys, even the fingers and the metatarsals and the feet, you're still doing 3 minutes each position?
yeah.
Oh,
Now, I mean,
okay.
if you do 1 or 2 minutes, you will still get some benefit. But if you really want the magic to happen, you want to connect the breath for the three and just, I mean, try it. Try it for 1 minute, try it for three, and just notice the difference.
Okay. Okay. That sounds cool. All right, let's see if there's any other questions from our VIP guest today. Yeah, so Lily says, I'm excited to try to release massive tension in my neck and forehead. Yes. I see myself in pictures. I still do it. But what happens is I get this thing going, you know? Like And I just saw my wedding pictures, and I'm like, I just kind of, it's like gravity just goes like this, and I'm
Well, and
smiling
that's
like
going to be
this.
driven from here, though. So as soon as this
Mm,
happens, this happens. So it's not just your neck protruding. There's going to be a foundation happening here, but then why is this happening? And that's going to be driven again from your hands and your feet.
right. And well, and then the physical therapist I was telling you about earlier, she says I was had a backpack on in Toronto. We were, going around doing different things, and she's looking at me, and I'm like, "What are you looking at?" And she's like, well, okay, since you asked, your pelvis and your rib cage should be stacked on top of each other in like optimal, and you are shifted forward, like your rib cage, because I had that lordosis, so that rib cage is out and that butt is out. My pelvis is in that interior tilt, and it's just a habit. And of course, having the big, book bag probably didn't help. I was like literally like this, you know.
Well, and you create that when you're skating too, right? I mean, like
Mm,
that's the posture that your body goes into to create this forward momentum. So, I mean, if you did that multiple hours in a week, week after week, now that's patterned, especially as we grow. I was a Highland dancer when I grew, and part of the thing we had was a turnout. We're jumping on the
right.
tips of our toes with a turnout. So, and then I was also a provincial volleyball player and I was a power hitter. So, between that turnout and the rotation always from one direction to another, I created so much confusion in my back and so much pain and trauma that, I had to work through over years to undo because when we do it when we're developing, it's very different than if it's happened when we're fully grown. It's a very different dynamic. So,
Ah,
yeah. So, I
yes.
mean, and kids today, they need assistance because exactly. And they're the babies today are also coming out from mothers that grew up in front of technology, so there's less space in here for them to develop properly. And in yoga, they say we're born with a signature posture, and the goal of this lifetime is to break through that signature posture. The way I see that, we are born into this lifetime with our mother's breath. So if we had a really calm, healthy mother or a really stressed, unhealthy mother, those are going to be very two different babies coming out and how they interpret the world, and then the world afflicts them. So the kids coming into the world today have so many more challenges than our generation, and I mean I'm seeing it in their alignment. It's crazy what's going on with these young ones. Like they're already so twisted and
Wow.
yeah, but fortunately there's solution. But again, people have to
Yes.
take ownership of their body and recognize that we can manipulate our fascia in a positive way with intention. But if we aren't conscious,
Mhm.
gravity's going to drive you, and they're going to be aging a lot faster than we used or than we did.
Right. Well, this is not a common conversation that I see among our young people. Like I'm at the rink and there's all these young people and they're, teens, something like that. And while they're waiting for the ice to get cut or whatever, they're like this. They're hunched over and they're looking at their cell phone.
Yeah.
And I just kind of go, oh, not that I don't do that, but but just watching this mirror of them doing that, I'm like, oh my gosh. And then
Yeah.
like all the lines that are happening on their necks because of this
I
thing.
know, right? Like they're so deep, so young, their hairlines are also
Oh,
receding. I'm seeing that in young girls
mm,
so early where
wow.
their hairlines are way back now because this also it's causing like the scalp is getting pulled or the skull is pulling forward, the scalp is going in the opposite direction, and
Oh,
now their hairline, like these hair follicles are getting
wow.
strangled with adhesion, and at such a young age, these changes are so like they're right here. We're seeing them.
Oh my
Not to
gosh.
mention all the other like issues that they're having. I mean, these are just the
EMF
physical manifestations.
toxicity and
Yeah.
TikTok toxicity.
Yeah.
Um, so the good news is that I think fascia is becoming a household word or soon to be becoming a household word. You know how it is on the algorithms, right? I like your stuff. Immediately I get five other channels that talk about fascia. So I think that's a really good thing is that it is becoming a conversation, especially those who are health conscious. So
Mhm.
I was thinking, wow, we need another fascia telesummit or something.
Oh, there we go.
All these amazing experts on there. So it's been really cool. And we're just about up time. Okay, so let's see. All right. Okay. Yes. Okay. So this is top of our list of 2026. Guess what? We can be accountability partners there together doing this. Thea says, thank you. I need to do more to understand and do this. I hurt my body too many painful situations, calf pain and in the morning. Could that be due to feet issues? So if you
Yeah.
have calf pain
Yeah.
in the morning.
And really just start with that toe work. It's free. Just again, like you don't have to do every toe all at once, but see what happens if you can give yourself 1 week of that. Note how
Mm,
you feel, even take some pictures. Because again, like if you've got a ballooning belly, it's now locked in your feet. So you can do
okay.
all the work in through here you want, but if we don't change that, that's not going to change either. We really want to have 60% of our body weight on our heels. Most people have 80+% on the balls of their feet with a twist. So
Right.
to repattern that changes everything up the chain.
I'm guessing you don't wear high heels.
No. I don't own a pair. No, I basically I live in like flat flip-flops or like flat boots in winter. I've got like two pairs of shoes. I'm not a shoe girl.
Right. Right.
I'm a
Well,
barefoot
Deanna,
girl, actually.
it's been great having you back here on the podcast. Really great stuff. I'm going to put in the show notes below this that you'll see, all the different links. You can see Deanna's work and also the starter program, as well as the 9 class, the free training with the towel. That's really fantastic. We'll make sure that ends up there. And so, Deanna, any last words before we end for today?
Oh, Dr. Ken, I just so appreciate you and being here to share with your community is such a wonderful gift. So thank you so much. And one last thing, my tagline is breathe and believe because you really
Mm.
can believe in this work. If you do it, it works for you. And that's really just what it comes down to.
That is beautiful. Thank you so much.
Thank you.
All right. Much love, everyone. Thanks for being here.
Bye.
Bye. Hey, thank you so much for watching. If you resonate with this message, please hit like and subscribe and perhaps share it with someone who's like-minded, who you think might benefit. And in the meantime, I would love for you to connect with me in my private light medicine community. It's free to join and it's for sensitive souls who desire to love and support each other. So I'll put the link below as well as other exciting offerings for this week. Much love. Thanks for watching.